Hello, doctor. We are live. We are live now. We can start.
Respected participants, ladies and gentlemen, very good day to everyone. Welcome all the participants to our third preventive and conservative medicine webinar. The topic of today's session will be on scoliosis. It is a medical condition to which a person's backbone or spine has an abnormal curve. There is a lot of belief or wide views on the scoliosis, and most of them are to be taken with a pinch of salt. Today, our speaker, Dr. Chiu Eng Hai from M University, Malaysia, will clear your doubts with a simple understanding of scoliosis, underpinning by the science and its management option in the layman language. Let me introduce our speaker for today's PCM updates. Dr. Chiu is a medical practitioner by profession, and he is affiliated with the Faculty of Allied Health Professions, M University, Malaysia, as an adjunct research and innovation consultant in the School of Physiotherapy. He graduated with the MBBS degree from the Bangalore University, India in 1994 and obtained a diploma in sport medicine from Australia in 1998. He is a chairman for medical subdivision of Malaysian Invention and Design Society, and also is a member of Society of Occupational and Environmental Medicine, and also a member of Euro-Asia Colorectal Technology Association, EACTA International. His area of research interest is a conservative approach in medicine and class 1 medical device. He has published several papers in the related areas, invented many class 1 medical devices, and won multiple local and international innovation awards. He is one of the key sport medicine doctors who has actually made our Commonwealth game a success. This is the biggest sport event ever organized in Malaysia. He is also an occupational health doctor with nearly 20 years of clinical experience in managing musculoskeletal problems, which is closely associated with ergonomic issues. And as we are aware, a good ergonomics would not be possible without a good posture. Today, we are very fortunate to have Dr. Chiu with us to share his idea and experience in understanding and management of scoliosis in the layman language. Please welcome Dr. Chiu.
Thank you. Thank you, Prof. Yu, for great introduction. Thank you for participating. Welcome, everybody. First of all, I would like to thank Prof. Yu, Ames University, for inviting me for this session. So I hope I'll be able to serve the purpose of making you understand the scoliosis in the layman language. Today's purpose, actually its main target, is for a patient with scoliosis. So our topic today is understanding scoliosis. And with my experience in occupational medicine, I have seen a lot of ergonomic related issues, and we realize that without a good spine, without a normal posture, that is almost impossible for us to have good ergonomic. So that is the reason why we give this topic. I think medical, we have paid sufficient attention on ergonomic, but about posture, the importance of posture, I think there is still a lot of room need to be emphasized. Before I start, I would like to share with you that disclaimer that this is an presentation is not official medical device or treatment plan and is intended for education and demonstration only. The presentation should not be used to self-diagnose and self-treat any health or medical physical condition without supervision of a professional. We agree to indemnify and hold harmless the presenter, his employer, and the organizer of the event for any losses, injury, damage result from any and all claim that arise from your use or misuse of this presentation. In short, we encourage you to go back to your professional if you have any issue. So let us start. What is scoliosis? Scoliosis actually is just a abnormal lateral curvature of spine of 10 degrees or more with corpse angle. It can be C-shaped, this C or this C, or S-shaped. And usually, it's not usually, it's almost all the time, it comes with some rotation. So what is the rotation? If you stand on the floor, a line draw between two heels, and then a line draw between the shoulder, if it's not in the same plane, that is meant by rotation. That means scoliosis is three-dimensional. It's not only merely lateral angulation. For simple explanation, that we will be focusing on the lateral curvature. So, what is the pathology, or what is the disease? Which part of the problem, or which part of our bodies actually having a problem? So, we all know it is due to the malalignment of the bone. The bone can be deformed or not deformed, but it is actually also associated with ligament tighten on one side, which is imbalance, and also muscle imbalance in strength when it compared to one side to the other. So as what the diagram show, this is the spine, and this the ligament on one side is stronger than the other side, tighter than the other side, and muscle on one side is stronger than the other side. How to diagnose? So we can see during even physical examination, head is not center, and the shoulder on one side is higher. Shoulder blade is more prominent on one side, and spine sometimes can be obviously curved, and there is unequal gap between the arms and the trunk, and one of the hip may be more prominent than the other. So one simple test that we can do just by bending forward, we call it Adam test. By bending forward, we can see there's asymmetry of both sides of the spine, and in this we can see this is clearly more prominent or higher than the other side. So academically, we calculate, we grade this corpse scoliosis with corpse angle: mild when it is corpse angle 10 to 15, moderate when it is 20 to 20, 20 to 20, 45, and the curve is more than when the curve is more than 45 to 50, it is severe, and when it's more than 90, it will cause respiratory compromise. So how common is that? It is affecting 2 to 3% of general population. Usually female are more than male, and majority of these scoliosis are actually minor, which is 10 to 19 degree. Most of the scoliosis first diagnosed during the teenage year, during the secondary school time. So, and since the majority of the problem are minor, why should we bother? Actually, we cannot just ignore, because it will get worsened. During the teenage time, before the bone ossified, the bone is still soft, so it will get worsened. Maybe when it comes to 24, 25, the bone is already mature, it stopped worsening. But when you come to menopause, with osteoporosis, the scoliosis is going to worsen as faster rate. So that is the reason why we should not ignore, even though if you have scoliosis of minor degree, or even asymmetry without considering scoliosis. When there is asymmetry, it's better to have early precaution and watch out what are the things that we should look at to prevent. So complication. So if we do not handle this thing, when things go severe, it will lead to complication. The most common complication is it associated with back pain, and the more severe form, it may lead to a breathing problem. This is, I think, it's quite well known to cause that, but this is only at the extreme situation. And the other thing, it can cause low self-esteem, prone for injury, intervertebral disc prolapse, reduce productivity, work productivity, financial burden, and also when we need surgery, there will be associated complication with surgery. Scoliosis is classified or categorized to different different type or different based on type, based on etiology. Here we can see it's first, the most common one is idiopathic. That idiopathic means we do not know the cause. That based on age, it called it as infantile scoliosis, juvenile scoliosis, adolescent scoliosis, or it can be congenital due to osteogenic or neuropathic, and so on. There is many other classification, and here it is classified based on etiology, based on the cause. So, and I think we are not going to go detail about this thing. This is there is too much academic aspect. Even metabolic disease related to nutrition, it also can cause scoliosis. And we know trauma and even neoplasm, which can affect the bone, can also cause scoliosis. Let us put aside this complicated knowledge first. So, for your information, you may have so many category, but this category, idiopathic, that make up of 85% of the total scoliosis. So, idiopathic means unknown cause. And this is the major cause of scoliosis. Is it really unknown? If we do not know the cause, how are we going to manage the problem? So let us see how can we understand this problem. So there are a lot of studies going on trying to relate this idiopathic scoliosis to genetics. So mean to say, and it may be implied that the treatment should be in genetic treatment in future. So that probably is also very complicated for now. So we are trying to see how we can understand from simple mechanical logic from aspect of it. So this is a diagram which I made representing the spine, ligament. Here we have intervertebral ligament, with intervertebral ligament in between the transverse process and another ligament, and we have this paravertebral muscle on either side, on both sides. So actually, a posture can change due to multiple factors, as we can see in the various type of cause or in the category that actually contributed by multiple factors. Can be posture, load, duration, age, sex, everything. So for example, if you are asked how many kilos that a scoliotic patient can carry, is it 5 or 5.5 or 4.5? It's very difficult to come out with the absolute figure, objective figure, because it depending on so many factors. We can carry a load of 20 kilos, but it depending on the which type of posture that we are in when we carry. So if we can put it, this circle represent the ideal posture that we hope to have, and we hope everybody should practice this. But normally we have also a range of physiological movement that is allowed. Example, I can sit in a very unergonomic way, provided it is just only for short period. So that it is still within physiological limit, it's not going to cause any harm. So that is, when we extend the limit, there is another level, we call it physiological limit. So maybe for certain sport athlete that they want to go extra mile to stretch their body to have extraordinary effect, ability. That's why that we should form the limit of, I call it extraordinary physiological limit. And beyond that, maybe it started to give problem. A problem cause disease is called, but at that time maybe it's not so bad and it's still reversible if you do something. But if you ignore that, if the damage is so much, and sometimes it is irreversible, and probably that times that we need to have a surgical intervention for that. So I'm giving example of how human can go more than normal physiological limit, and we still don't consider that as disease. Like gymnasts, they can stretch their ligament, and with regular practice, they can go to the extent even malform the bone. Do we call them pathologic? No. Actually, they have more better ability than us to perform certain things that we cannot perform. So if in summary, if you look at the whole thing, these three main tissue is the main contributing factor. So muscle, ligament, and bone. So we have to understand the feature of all these three features. So exercise, when we do exercise, muscle will be strengthened and toned up. Then ligament will get stronger. Next is when we don't use the muscle. Muscle is when we don't use, though you don't do exercise, muscle will be the first to be weakened and followed by ligament. And over a prolonged period of lack of exercise, our bone also get weakened. So when we stretch, ligament, muscle get lengthened. When we do not stretch, just like athlete, like gymnasts, they don't stretch for 1-2 weeks, they will feel tight because the ligament gets shortened. So when we challenge our bone physically within the physiological limit, it will strengthen the bone. So when we compress all these three tissue, it will decrease circulation and ultimately devitalize, tissue will damage, and the tissue will, the structure will start to weaken and shrink. So with that rationale, let us see what happens when we do our normal movement. Example, when we bend to one side, this is not an ideal position that we want to encourage the person to remain for a long period. So if you just remain for a short while, it is normal, it's within physiological limit. But if you remain, you have a habit of sitting, if you have a habit of sitting in that position for long, so when we stay in a bent position for too long, the opposite side muscle get weakened, the ligament also slowly get lengthened because it's been stretched. And we continue to do that. As we know, the compression will decrease the blood supply. That it will decrease the blood supply of the bone. Later on, if you still continue, it will devitalize bone tissue, the bone cell, and then start to shrink, deform. And with that, the deform of the bone, vertebra is there, alignment is altered, and the capsule will be pushed on to the opposite side. This will increase the risk of disc prolapse. A day will come, a disc may prolapse if we don't rectify the problem early. So back to this classification with scientific academic classification of various type of diseases. How do we interpret into the three basic muscle, ligament, and bone? So look at here, osteogenic mean bone problem is related to bone. Neuropathic, that means it affects the nerve. With the nerve affected, the muscle cannot perform. So practically everyone can be translated into this basic three pathology, which is bone, muscle, and ligament. So similarly, with this classification, there is no problem. We can just interpret into the muscle and the bone. So when it bend, it is not only lateral bending, it is three-dimensional, involves certain amount of rotation. What could be the reason for rotation? Anatomically, beside the joint between the vertebra, there is facet joint, which is at the angulation, at the slanting. So when you bend, this facet joint will guide you to a slight rotation movement. So why female has more scoliosis than male? One of them scoliotic. They look normal, they look attractive, and this is feminine look. Can we consider this constant postural habit as an important factor for a so-called idiopathic scoliosis? Based on just now logic, I think with this, if these ladies keep constantly, habitually put herself in that posture and for a prolonged period, that physiological changes take place beyond certain limit, it started to become pathology, and that led to scoliosis. This girl at 20 years old, with this picture, we will say it's sexy. But if the 60 years old come with this position, with the bone spine, and it looks the same. And at this stage, it's still able to bend back. It still be, but at this stage, the bone is already changed. So that it lead to a situation that cause torturing to the patient. So happen in our Malay language, sexy means sexy, but on the worst extreme situation, it becomes sexa, which means torture. So women seldom in a straight position. When they are in straight position, somebody is going to get hurt badly. So, and that is just a joke. So, another logical contributing factor that may help us to answer why a person may have scoliosis and women have more, and this is because of the way we carry burdens. We carry babies and we carry loads on the hip because they have bigger hip than men, so they tend to have to carry the load on that. And the way we pull our luggages and how we carry our backpack, which on one side, and even the sling bag, which can be very light, but because of the postural habit, it will make the person more comfortable in certain posture, and over a prolonged period, it can lead to formation of scoliosis. And this is another contributing factor that we should watch out for. Men may have habit of putting wallet at the back pocket. So they tend to put on one side more comfortably. So that will also mold and deform the bone and lead to a scoliosis formation. Also, like this man is carrying the load on the shoulder, if he's used to carry on right side, he will not be very comfortable to carry on the opposite side. He tend to carry on the same side. That will be contributing to the scoliosis also. So how to correct this thing? So we have to understand the cause in order to able to correct. Now we have know that factor. So first, do no harm. Just remove all this contributing factor, all this bad habit. Just have to remove. Stop contributing to scoliosis. That should be our first step. So if you compare to orthodontic malalignment of the teeth, that they can be correct so nicely. So this is based on the concept. If you apply a constant pressure from one side to the other side, and on this side, the bone will be undergoing compression. So we know undergoing compression, the cell will damage and it start to shrink. On the other side, the bone will be under traction, and with the traction, the cell will start to grow more. So this is based on Hutter-Walkman theory. When the bone compress, it will devitalize and the growth will slow down. And when the bone is full, it will go under traction and increase the cell formation. So with this explanation, we will know why gymnasts, they are usually shorter, because they routinely land impact that compress on the growing bone, and that stunted the growth of the bone at that part or the impact site. And based on the same theory, with the traction, that a dwarf can increase the height of the length of the tibia by external fixator that give constant traction onto the bone. So the most important thing for orthodontic is the rubber band that they apply in certain direction to pull the teeth to form. It's just like how we form this bonsai tree. It takes a long time for it to shape. So back to this. How are we going to fix rubber band? We don't have a rubber band. So, but we can do by exercising. By exercise, with targeting correctly on this convex side, it will act as a rubber band when the tone is increased. When we exercise, muscle gets stronger, and we can also stretch on the opposite side, on the concave side, to loosen the tightened ligament or tightened muscle. So the ligament becomes stretched and longer, muscle stretch and longer, and the disc on this side will be decompressed. And the ligament on the other side, which is lengthened, because of because of the contraction over here, is not frequently overstretched, it becomes shortened. So the vertebra which has been compressed here, it will be decompressed, and the blood circulation improve. And we know what will happen when blood circulation improve, the cell formation will be better. And likewise, as we continue to practice exercising, increase the strength of this muscle over this side, and continue to do stretching exercise to lengthen this soft tissue on the concave side. And if it's not beyond certain pathological limit, it should be able to back to normal given sufficient time. So what are the this give an overview, the option of management for physiotherapy. So just now we were talking about three components which is important in the scoliosis in the spine. So let us see how are they interrelated. Physiotherapy react on the ligament and muscle. By strengthening the muscle, by stretching the ligament, this is how we achieve. Scrot method, also by muscle and the ligament. Yoga may be more of ligament than muscle. With braces that we put braces inside, it is actually maintain stretching on the posture, which is stretching on the ligament with exercise inside. It may contribute by strengthening the muscle also, provided the person undergo also practice exercise with braces on. Surgery is very simple. It just fixes the bone part. So stretching, there are many methods of stretching. Stretching has been adapted since long ago in medical history, and these are the various types of stretching that you can perform. This inverted also a form of stretching. You can stretch with this horizontal bar, and you can stretch in this manner, and there is many more stretching methods. These are two devices that we can use this device to do stretching on the chair, on the bed for stretching, and at home we can do simple stretching by just a cross bar at the toilet door. And if you cannot hold on for too long, you might want to use this arm sling that distribute the area of pressure, then you can last longer. Or a simple way that you can use a door, partial weight bearing, then you can also do your stretching at your comfort home. So with scrot method, actually a combination of various types of stretching and exercise that form what we call as scrot method. And there is also a therapy involving elastic band used in various ways. The concept is also based on stretching and strengthening of the muscle. So let me stop this sharing for a while. And can you see the video? This is a model which I created. If this is a scoliosis because one side is tighter. So stretching purpose is just to stretch, and hopefully by stretching we lengthen or soften, weaken this part which has been shortened. So that is the whole basic concept of stretching. Let us go back to this PowerPoint again. So that is the basic concept behind the stretching. So we can also do home stretching where using a towel and lying on the convex side and allow your body to straighten. With that, you are stretching the concave side. But with just stretching alone, loosen the tighten side on the concave side, that is not sufficient for you to have the correct your posture if the convex side muscle is not being strengthened. So we need muscle exercise. So any exercise will do. If you look at this picture, these few gentlemen and these ladies, they are well built. That is evidence that they have done a lot of exercise. And looking at the size of the muscle, they could be able to bend metal, but they can't even correct this bone, which is made of collagen and calcium. Why? There are a lot of exercise for scoliosis. We have to understand each role of each and every muscle exercise to be precise, to be accurate for patients, individual patient, then only we can achieve. So let us just brief through. Braces is just used to correct the posture, and what it does is actually constantly provide passive stretching on the soft tissue, muscle or ligament on the concave side. So if a person just use the braces without exercise, they are going to have the common problem just like POP, the muscle become disused atrophy. So with the braces on, you still have to intentionally using a contracting your muscle to straighten your body, so to build your muscle. Otherwise, your muscle will be passively inside or undergo atrophic changes. So if last resort, if everything fails, surgery is an option. So surgery, this fusion surgery has been there for a long time, and good news that today the world is introduced with new, relatively better surgery, flexible fusion surgery. The patient will be implanted with flexible material on one side, so allow the woman, the ladies, to still have some limited movement, except for flexion to the opposite, the side which is opposite to this cable. So back to the muscle. There are so many muscle exercise. So which one to do? And we have to understand which muscle to target. So we have bone, vertebral bone has joint in between all the bones. And the muscle is there to help to give the support. It's just like a tower. A tower is standing straight, but the cable by the side surrounding has to be coordinated properly in order to give the strength to the whole tower. So when it started to bend, we have to balance it back. So it is just like the other part of the body. We have agonist muscle. Agonist means flexion part, and antagonist to that is the extension. Same thing when you have a muscle to flex on one side, the other side, the opposite side, is antagonist muscle to this side. If this is the agonist muscle, opposite side will be antagonist to that. So looking at this picture, for this gentleman, he has a scoliosis where his shoulder lower on the right side. He has thoracic scoliosis, and we got to target exercise to strengthen this part so that the muscle tone will be stronger, and it started to give contraction and correct slowly over time. It will correct that. So this is EMG, electromyography study, where we use this electrode to measure electrical activity by the muscle. When the muscle contracts, there is some electrical activity. By detecting the electrical activity, we will know how much of contraction. It will give us the information how much of contraction is there. So when you place two set or two pair of the electrode, then we should be able to see which muscle is actually working. So what we want, our target, we have to have this red color has more electrical activity. Let's see. So this is one of the commonest exercise physiotherapists prescribed to patients with scoliosis. We call bird dog exercise. Bird dog exercise, in this, he has right hand up and the opposite left leg up. This is one position, position 1, and position 2, just opposite, left hand up, right leg up. So let us see, is there any difference? Can we just prescribe to everybody? So this person has scoliosis bending to the right. So for this, right hand up, left leg up. In fact, he has more contraction on this side. We want this contraction on this side, the red color side, and it is just opposite. That means to say, if you continue to do this, it's likely that the scoliosis will get worsened. How about this one? So when you do this, you can see this left side contraction is significantly more than the right. So this is what we want. So this is an example that exercise, not every exercise is suitable for a person with a certain scoliosis. So let us see another exercise. We stretch upward. With this upward pushing, you can see the muscle is significantly the contraction is significantly more on the left side. That is our targeted side. We want that side to be contracted to build that muscle. So if we continue to do this exercise, it also helps. That means to say, with this exercise and this exercise, it's going to help this patient. So we have to understand that there are a lot of variety, a lot of combination. We have C shape. The C can be on the upper part. The C can be the lower part. It can be opposite C. It can be S shape. It can be reverse S shape. So we found that not every exercise are beneficial to a specific person. So exercise has to be tailored exactly to the patient's individual need. So in conclusion, we realize that actually in practice we can see conservative physiotherapy management is not optimally utilized in the management of scoliosis. Patient understanding and active participation and compliance are essential for effective management of scoliosis. Other important take-home message for you is physiotherapy correction need times. We have to understand this. A lot of time patients go to physiotherapy after 1 month, 2 months, they started to have doubt and they change. And they may end up in different type of therapy that may end up wasting their money, and worst thing, it may end up in complication. So because they do not understand, and even an effective physiotherapy, you are not going to see the result within 1 or 2 months time. If you do it wrongly, you are not going to realize that your exercise is wrong within 1 or 2 months time also. So we got to be persistent, and you have to understand. So that's why we need guidance of physiotherapy to ensure that the effort done beneficially to your scoliosis. So the patient has to be reviewed by physiotherapy from time to time. It means with your understanding, you may do a lot of exercise at home, but you still need interval. We consult physiotherapy at the regular interval. Make sure that you are not doing something not helping, or the worst thing is harming your scoliosis. So recommended exercise is likely to differ from one patient to the other. And recommended exercise for a patient may also differ from time to time for different stages of recovery. So, and the other thing is, I want to remind again, compliance of patient is very vital for the optimal outcome. So, with near conclusion here, these are the two, for time being, what we have found, these are the simple exercise that you can do at home. Vertical stretching. This is actually active contraction of the muscle on the convex side. This is what we want, active contraction of the convex side. And by doing stretching, even partial stretching, you are doing a passive stretching of the ligament or muscle on the concave side. These two will help the bone to get straighter and straighter. So beyond that, any other exercise you have doubt, you better consult your physiotherapy before you're doing more harm to your own bone, your spine. So with this, we're going to end, and in the upcoming, I think because of the time constraint, we only cover certain parts, mainly on introduction, and hope it's helpful to you. In future webinar or workshop, we're going to share with you more information so that you can learn more and you can practice more. We are going to cover applied anatomy of scoliosis, biomechanics or kinesiology of various physiotherapy exercise, biomechanics and kinesiology of common routine tasks when you carry your weight. So you have to see what is the impact of the weight onto your body. So I think if we do something to show you that make you understand what is the routine activity that you have done, what is the impact on your scoliosis. If you understand that, by correcting that, you practically can just like live whole day in physiotherapy. What is the point if you can go to physiotherapy 1 hour a day, the other 23 hours you do it wrongly? So the 23 hours will overtake the effect of 1 hour. So your understanding is very important. So the other Our objective is to help patients to understand anatomy of their scoliosis, to identify best specific exercise or exercises for their scoliosis, to find specific way to carry out their daily routine tasks without causing harm to existing scoliosis, and to provide best therapeutic effect on their scoliosis. So with that, I thank my presentation here. Thank you very much for participating, and I hope I'm helping you to have better understanding of your scoliosis. So back to Dr. Yu. Thank you, Dr. Yu.
Thank you very much, Dr. Chiu, for this very useful sharing. Now I want to open to the floor to ask about 5 to 10 minutes to ask questions. Anyone want to ask question, please maybe raise your hand.
Hello, Dr. Yu.
Yeah.
Okay, I have one question about the scoliosis. May I know if the scoliosis is let's say it's a S shape for the scoliosis that is already for few years lah. So if let's say if uses the exercise that just now the Dr. Chu recommended, that holding on the how to say
The bar.
holding on the bar. So how long can the scoliosis can be can be okay?
Okay, I think I leave it to Dr. Chiu, our expert, to answer this. Please, Dr. Chiu.
All right. Thank you for questioning. So yeah, this is a very common question. You have to understand that what I told just now. There is multiple factors playing their role to form the scoliosis. So first, if you say scoliosis, the malalignment, we have to understand the severity. To what extent is the bone is only affecting the ligament and muscle? Has the bone malformed? So that will determine what type of treatment and how effective a treatment will be. So back to this model, which I have created. So imagine this person having a scoliosis like this. So we know we got to stretch this part. That's why we're hanging. We do the hanging exercise. The other thing, we got to target to strengthen this muscle. How to do is just like the few exercises that we have done. Imagine this muscle has been strengthened. As the muscle gets strengthened, you can see the result on the scoliosis. So slowly, the scoliosis get corrected. So likewise, from time to time, we review and we may shift the target of the correction. So you have to understand, scoliosis usually started at the thoracic side, upper side. So with that scoliosis, we realize our shoulder is higher on one side. So what you tend to do is shift the shoulder to balance it. So with that, sometimes what you do, instead of you correct this part, you actually bend this side. From C, it can end up with S because you do not assess it professionally, measuring the corpse angle. Let physiotherapy see, in certain situations, you might need X-ray or even MRI to have better understanding of your situation. So I hope that answers your question. It depends on your severity, and it also depends on your commitment, your exercise commitment, how frequent you do that.
Okay, so that means I need to consult to a doctor first, is it?
It's better to do that to understand your severity of your problem, any associated problem, and then once you rule out all these potential complication, then you can you should understand the scoliosis specific to your problem, and then you should know where to target and where to exercise. With that, for that, I think physiotherapy will be very helpful for you.
Okay, so the doctor will suggest, is it, for the exercise?
In the real practice, I think in the real practice, a lot of doctors are actually tend to treat symptomatically medication. They may advise you on exercise. They may refer to physio. But I think the person who are more familiar with that exercise, that therapy is physiotherapy. You still need to go to physiotherapy for better understanding. Doctor may not have sufficient time to go detail about this thing.
Okay, thank you, Dr. Chiu.
Thank you, the madam. I want to open another questions to the floor. Anyone want to ask questions?
Hello, I'm Dr. Louis.
Yeah,
Can I
okay.
ask a question regarding scoliosis and fitness to work? So, say a person has scoliosis. So, what are the determinants to, to assess that the person can go back to his work? Of
Yeah,
course, like scope of job, the kind of thing, his
yeah.
capacity to work, his mental. What are the things that you look at?
Then this is more for on the occupational health doctor.
Mm. This is more on occupational health. So it depends on severity of the scoliosis, I think. People handicapped deserve a work to survive. So those who have scoliosis also, we cannot just simply just unfit them. We have to understand the nature of the work. If the work involves a lot of carrying, load carrying, I think that may not be able to. So to what extent we have to assess really what is the load that they use to carry every day. So and also in certain situation, we should assess and follow up the scoliosis situation in gray area that we still, example, in certain situation that person do not have other skill to other job that he just depending on that one we have to be very careful. If any signs of worsening, that we have to seriously consider remove him from the job. There is no absolute angle or absolute weight we can see. No point we only look after the working time. How about his next day-to-day posture habit? A lot of time we are putting too much of concentration, effort, or blame on ergonomic. But while the person at home, when he sit, the way he sit, the way he sleep, the ergonomic posture, the normal posture is not being properly maintained, it's practically impossible to have a good ergonomic posture. So, and we tend to ignore those have asymmetry because we say less than 10 degree, we classify them as functional. We just don't do anything for them. But I think at that stage itself, we should make them understanding the mechanism of scoliosis so that they do not get worsened from that situation. And I think we can see quite a lot of cases of disc prolapse. Disc prolapse, it will prolapse to one side. Physics by physics, if the pressure on one side is more, the other side is less, it's more tendency to prolapse to the other side. So unless we correct the posture back. So answering that question is actually depending on so many factors and also their financial situation and also job nature and also their skill.
Thank you.
Okay, thank you, Dr. Louis. I just open one more questions to the floor.
Hello, Dr. Chiu. So I just want to ask one question. Is it jogging is good for, for the patient? Is it jogging is very good? Because I didn't see any, jogging in the list for the patient.
Yes. So that's why I do not want to list out what is good, what is bad. And instead of that, I make you understand the contributing factor, the components, and each component contributing factor, how severe, or it is a spectrum of problem and a multiple axis and with the multiple severity. So logically, when you jog, your body weight jerk vertically. So when you jerk vertically, when your spine is bent on one side, there is a tendency for the concave side to bear more weight. So we know a long repeated compression on that side, it will further damage the bone on that side. That's why I would recommend not to jog, but it depends on how severe and how bad is your scoliosis. If it's minor, and I think it's better than allow him to do, if he don't do other exercise, he should do some exercise. The best is when you have scoliosis, I wouldn't advise for something like jogging or jumping. So, if it's minor one, maybe it's okay. But still, even when I say okay, it doesn't mean that it doesn't cause harm. It may still cause harm. It may cause harm, but it's a lesser intensity. So if you can take other exercise like gym, that will be good, because gym, you control which muscle to contract, which muscle to do. That will be very helpful. We can target on the area that you need exercise more.
Thank you, Dr. Chiu.
Thank you, thank you. Any more?
Dr.
Yeah,
Chiu. So for those who already undergone scoliosis surgery, some they still have bad posture after some years. So will the exercise helps for those that already have implanted with steel in the backbone? Yeah. Thank you.
So this is a difficult question for me to answer, because when you have implanted metal inside, actually we sacrifice the flexibility of the bone. So I cannot answer that unless we know which part of the bone, which part of the spine has been fixed, which part of the vertebra, the flexibility has been compromised. So imagine you have already compromised the movement of this side, you just still try to move. What would happen onto the side, the end of this metal? That I think is better to ask surgeon who perform the surgery on the person whether what type of exercise they can do. As in general, I would say you should avoid exercising involve flexion of this vertebra.
Okay, thank you for the questions. I want to give opportunity to one more questions. If no more, I want to ask one question to you, Dr. Chiu.
Yes.
For the scoliosis patient, how we want to ensure that the position of sleeping to ensure the comfort and also to relieve pain, because they need to sleep every sleep. So what type of position you recommended?
So this is a very tricky and very good question. I think we have to see from the theoretical point of view, and it's easy to answer. You got to make sure your posture of sleeping is correct, everything. But in the practical aspect, can we do that? So a person already in the deep sleep, that is very difficult to control. So I think basic thing, the pillow shouldn't be too hard, the mattress shouldn't be too soft and too hard. And I think we should give some freedom to the sleeping. So we can put the person in the ideal position. After 15 minutes, it may change position. So how to have a good posture of sleeping? And it depends on the time that we are awake. So when you spend more time or where you are awake to build the muscle to hold on to your spine. So when the muscle is stronger, so you enjoy flexibility of this during the sleep time, and yet you have a good comfort sleep, rather than you try to have a good posture but you have low quality of sleep, and whole day you'll be tired, you'll be slouching, and you'll be in a very bad posture. So that is very subjective. It's try to be as healthy as possible, but don't be too tedious about that and ignoring the window, the opportunity daytime that you can do exercise. Then you ignore that part and you just want to find a proper way of sleeping to solve this problem. I don't think that is near logical.
Okay, thank you. Dr. Chiu, one more question, my last question. What is the role of the bracing in the medical management? Because in our physio, we use a lot of bracing. What about in the medical field? What type of bracing you recommended, especially for those who are from the mild to the moderate as well as the severe scoliosis?
So the bracing, I think exactly what type of bracing, it depending on the situation. I think everyone has its advantage and disadvantage, but you have to come back to the basic principle of bracing. Bracing is trying to hold your body, it passively stretch the concave side. So when your body is bent because of one side is being tighter than the other side, brace is hold it up. So hopefully with that passive stretching, this has been stretched and it will back to its normal position. But if you're just depending on this bracing alone, I don't see any logic to be sufficient. Inside the bracing, you should also try to contract the other side. So over time, the bracing will remind you for not to bend further, and you try to use, there should be, usually they give you a room for you to extend up, that you, the muscle exercise inside the bracing is still play a very vital role beside you have bracing. So because if you see, if you're just depending on bracing, our spine is the strongest among the biggest, I mean the strongest bone. The rib is a very thin bone. How is the logic when you try to move the thick bone by holding on to small branches? So it is quite very difficult unless we have muscle contraction to pull this spine.
Thank you, Dr. Chiu. Okay, let me wrap up for the today's sessions. Scoliosis is a medical disorder when a person's spine have actually bent sideways in either C shape or S shape. So it occurs in about 2 to 3% of the population. Mostly affect age between the 10 years old to 20 years old, and in female more severely affected than male. So this is characterized by the normal curve of the spine, either in the different shape, what I mentioned just now, either in the C shape or S shape. So officially, there are multiple causes for the scoliosis, but majority of them is still considered unknown, as what the Dr. Chiu explained to us. But with the Dr. Chiu explanation, we should also aware that our daily posture and activity play an important role in contributing to our scoliosis. If the rationale clearly explained, we also know that there are plenty of room for conservative treatment like exercise therapy in the physiotherapy management. So with proper guidance from the physiotherapists plus a good compliance of patients, we foresee the majority of the scoliosis, which is about 10 to 19%, would have better prognosis. Hope with the today sharing, we should not take mild scoliosis lightly and waste our good opportunity to effectively manage our scoliosis conservatively. I'm looking forward for Dr. Chiu to share with us more details about what type of exercise specific for different shape and severity of scoliosis in the future. So remember our take-home message today: conservative first and invasive last. Lastly, on behalf of the organizing committee at AIMS University, I would like to thank everyone present for your participation. We look forward to see you again in your next PCM update. Bye. Thank you.